to Taking Turns, the Guilford County podcast where we talk about people, programs, and services shaping our community. Today, we are joined by Debra Mack, Director of the Guilford County Behavioral Health Center, in recognition of Mental Health Awareness Month. She's here to help us better understand the services available to residents, the importance of reducing stigma around mental health, and the continued work Guilford County is doing to meet people where they are. We'll also learn about the Peer Support Living Room, a new addition to the Behavioral Health Center designed to provide a supportive, welcoming space for people on their path to recovery. So, hey, Miss Debra, it's so nice to have you and getting to talk to you today. Welcome to Taking Turns.
Thank you. It's great to be here.
Yes, I'm so excited. So we're just going to hop right in. I always ask our guests, tell me a little bit about who you are and what you do.
Well, I'm Debra Mack. I've been a nurse for 30 plus years. And all those years have really been in mental health. It was where I found my niche. It was what I love doing. So I've been doing that for all my life, feels like.
I don't think that I knew that you were a nurse. But what kind of nurse were you?
I was a psychiatric nurse.
Okay,
I'm board
nice.
certified as a psychiatric nurse.
Awesome.
So once again, that was what I loved in nursing school, where I excel. So that's what I've been doing since I've grown up.
Very cool. Very cool. So for somebody listening in who has never heard of Guilford County Behavioral Health Center and they don't really know what happens there, can you explain to us what the Behavioral Health Center is?
So the Behavioral Health Center is a 24-hour area for crisis. If someone is in a crisis, they can walk in 24/7, 365 days a year. They can go to what we call the urgent care. So when you think about urgent cares for medical issues, this is an urgent care for mental health issues.
Okay.
So you can walk in anytime and be seen. And what they're doing in urgent care is they will do an assessment. And in that assessment, they will see, well, what level of care does this person actually need? Do they need an outpatient therapist? Do they need just medication management? Do they need inpatient? And they will help them get to that level of care that they need. So that's the urgent care part. Also in that building, what we have is facility-based crisis. And facility-based crisis is kind of the in-between. I'm completely an outpatient person versus I'm kind of teetering that I may have to go inpatient. So facility-based crisis is that in between to kind of help you get some more tools under your belt to maybe defer you from going inpatient and then just get you connected with your outpatient services. So to say there's about 7 to 14 days, just depending on the need. And there they participate in group. They have a social worker that helps them navigate some of the things that may still be going on the outside that they need to take care of while they're in that bed at the facility-based crisis. So that's kind of that in-between. And then upstairs, we have outpatient services, which are just that, outpatient services. You can see a therapist, you can see a psychiatrist, and you can do medication management on an outpatient basis upstairs at the center. And then we also have peer support. Peer support is that place where you just walk in when you need an ear. You just need someone to listen and someone to maybe help guide you through all these hoops, because we know there are some hoops to jump through when you're seeking mental health services. So they're there to help guide you through those hoops and help you get to the place where you need to be. And that's really what that center is all about, getting people to where they need to be, to walk hand in hand with them until they can get the services that they need.
So that was a lot of information, and we'll get back to the Peer Support Center a little bit later, but I was going to ask you if you could tell me, for somebody who's just walking through the doors, with that being so much information and so many different parts of the center, how would someone who's coming in know where they're supposed to go based on their needs?
The good thing is when you first walk into the center, there's a desk kind of directly in front of you. If you don't know where you're going, you can always walk up to that desk and they'll get you to the right place.
Okay, that's great. That's awesome. That's really good to know. And a lot of the information that residents are seeking when they come into that center, those questions will be answered by that front desk person. Awesome.
Yes.
So we know that May is Mental Health Month, Mental Health Awareness Month, and so I would love to hear from you. What do you think that people still misunderstand about mental health?
That's a good question. I think there's still a lot of lack of education as to what mental challenges look like. It's not that you have to have a mental illness.
Mm-hmm.
Life is life and for us all, so it's those challenges that pop up. It may be financial challenges, it may be family challenges, relationship challenges, work challenges, all those things. If they are piling on a person at one time and they don't have the tools in their toolbox to be able to manage that, that can become a mental health crisis. So it's not so much about you have to feel like you are mentally ill, which sometimes people look at that as someone who may be what we call psychotic, maybe hearing voices, maybe delusional. Those kind of things are sometimes what people look at as mental illness, or someone that's using substances. They look at that as mental illness. So it's not so much as an illness as it is life challenges. And sometimes we need help dealing with life challenges. So I think when people start to understand that, like, it's okay for me not to be okay with everything that's happening to me in life, that will help remove some of the stigma and really educate people of what mental wellness is.
That's a great answer. And I think that differentiates for people where what are they supposed to be asking when they come in, because the next thing that I was going to ask you was if someone is going through something and they feel like, well, I don't know if this is serious enough for me to go to a place like this to ask for help. Like, how do they figure out if this is a place for them to come and get help and find resources? Do you have people like that come in and just...
We do, but not so much since 988 came into play.
Okay, talk to me about
Yes.
988.
Yes, I love 988 because when I think about 988 and I think about 911, growing up as a child, you could not play with that phone and dial
Exactly.
911. So, but for 988, it is a number you can call when you just have a question. And that person on the other end of the line is going to be someone trained that can help you, walk you through through your conversation and assessment online to say, well, here are some services in your area. Like, just go to the urgent care and see if they can do it and get them to do an in-person assessment for you. That could be one thing that 988 leads them to. They may lead them to a therapist that's out in the community. So someone to kind of do a quick check-in with, like, what do I really need or what do I really want to go for? 988 is the perfect number to dial. And even text. Young people, the texts that are coming into 988 for Guilford County has risen over the last year. I don't know those numbers exact, but I know those numbers are on the rise because young people are using 988.
Yeah, with the text, that makes it so much more
Yes.
accessible to younger people who are just used to texting instead of calling. And they might be nervous about calling in, so they can text that hotline. So if anybody's struggling or having some mental health questions that they might need to ask, please reach out to that number. That is 988, and that is a free hotline that you can call and get some of your questions answered. So we can jump back to, I know you mentioned earlier, the peer support living room. That's what it's called, peer support living room.
Yes.
So can you talk to me about that newer addition? What is that, and what was the need that kind of pushed that to be created?
Just historically, the vision for the Guilford County Behavioral Health Center was that living room would be there. I think there were a lot of road trips taken. I wasn't in this role at that time, but there were a lot of road trips taken, and they went around and they looked at different peer living rooms in our local area, and I think Asheboro and Asheville. So they went around looking at the different peer living rooms, and that was a part that the commissioners and Cone really wanted to stand out in that building. Took us a while to get it to stand out, but now we have peers from our community, from different agencies that come in, and they're there. There's someone there from 8 to 5, Monday through Friday, where people can just walk in. And it's such a welcoming atmosphere, a non-judgmental atmosphere, and the comfort level of people using the peer living room now it's amazing when I see people walk in and they're like, oh yeah, can you help me with this or can you help me with that? Or they walk in and they've already know the peers that are there. Hey, can we play a game of cards? Can we, one of the peers there, she's like, "Oh, we got some snacks over here," always ready to feed somebody. So it truly has made a difference, and especially when someone comes into urgent care downstairs, and they may not need anything immediate. They may just need to talk. And the people, the staff doing the assessments downstairs, they don't have a lot of let's sit down and talk time when you're working in a crisis area.
Yes.
So they send them upstairs. Like now you can go upstairs and talk to a peer, when there's a peer up there, and they truly do engage with them.
And the phrase peer support, that might be a new kind of phrase to people, or people might just not know exactly what that means. Can you describe, like, what is a peer? What is peer support?
Yes. So peer support is someone that has walked their mental health journey. They walk through their journey. They have some stabilization time under their belt. It's 18 months of stabilization, especially if it's someone that's a substance abuse peer. They need that clean time under their belt. And they go through a certification. They're certified. They're called certified peer support specialists is what they're called. So they go through that training. And it is a opportunity to say, well, I have walked a walk, and now I can help you walk the walk. So that lived experience, that's really what a peer is someone with lived experience.
Oh, that's awesome.
And they know the right words to say. They know kind of like the climate that someone's at when they're coming in. And so they walk with them hand in hand as a peer, as someone who's been there.
That's really great. Do you have any, I know it's a newer edition, but do you have any good success stories that you could share about the peer support living room?
They've done a lot of groups up there. There's this one family that comes in probably once a week. I've seen them at least once a week. They come in with their, they have an adult son that's has his challenges, but he has really connected with one of the peers there. And he wants to come in every day and high five and talk about he's been looking for jobs online, and his mom and them have really connected with the peers. So it's truly been a family connection, and they feel so supported by the peers at the peer living room. So that's been an amazing transformation to see, because when he first came in, he was really withdrawn, really didn't want to talk to anybody. He would talk to that one peer sometimes. Now everybody comes in, he wants to give you a hug. So really an amazing whole family story. So that's that one story that comes to mind.
And that's awesome. I guess that lets our listeners know too, you don't have to come in by yourself. You can come in with your family or someone else with you for that support as well.
Yes, exactly.
That is awesome. So one other question that I had is more so about access and community impact. And I just wanted to know, for somebody who might be trying to access some of these resources and they might be worried about things like cost, insurance, transportation, or just maybe like not knowing where to start with that part, what would you tell them? What would you want them to know?
I would say any time that you are needing help, don't let money be a barrier. Don't let finances be a barrier. Don't let insurance be a barrier, because it's not a barrier for those that are providing care. There are always ways to help someone get to where they need to be. And even if you have Medicaid, if you don't have Medicaid, we have a Medicaid eligibility person in the center. You can go right to their office and they can help you walk through those steps. They can help you find a provider that may be on your insurance. So there's help there. So don't let not knowing how you're going to pay for care be a barrier. Don't ever let it be a barrier.
I just love how you have an answer for all of these things. This is just so great for our residents so that they know there are resources out there for them. There is help out there for them. While they may be struggling. And I know that this work can probably get a little heavy, but I imagine that is very meaningful to you. What gives you hope in the work that you do?
I find hope in always being able to touch at least one person. If you can touch just one, And then one other passion that truly is on my heart is that because I've done this work for so long, I know how it can feel to like be go unnoticed for what you do or not be thanked for what you do. And during Mental Health Month, that's one thing I always want to do is lift up providers and thank them for this work because, like you said, it is heavy work and it can be heavy. And sometimes we can lose sight of the good that we do. So that's one of the things I always want to do in the month of May is pull providers together and say to providers, thank you for what you do.
Yes, thank you so much to our mental health providers. Thank you, Ms. Deborah. This has been great information. Before we wrap up, I do always like to ask my guests one final question. If there was one thing that you would want our listeners to remember about mental health support or just the Behavioral Center in general, what would that be?
It's okay not to be okay. And the center is there to help you get to okay.
Thank you for joining us for this episode of Taking Turns. A special thank you to you, Ms. Debra Mack, for helping us recognize Mental Health Awareness Month and for sharing more about the services, support, and resources available through the Guilford County Behavioral Health Center. To learn more about Guilford County services, visit guilfordcountync.gov and follow Guilford County on social media for updates, resources, and future episodes. Until next time, take care of yourself, check on your people, and we will see you on the next turn.